In the latest issue of PLOS Neglected Tropical Diseases, a distinguished group of virologists, epidemiologists and infectious disease specialists say that's not a hypothetical question. They argue that Chagas disease, a parasitic infection transmitted by blood-sucking insects, has become so widespread and serious while remaining largely unrecognized that it deserves to be considered a public health emergency. Extending the metaphor, they liken Chagas stealth spread to the early days of AIDS. Both diseases are health disparities, disproportionately affecting people living in poverty. Both are chronic conditions requiring prolonged treatment courses. As with patients in the first 2 decades of the HIV/AIDS epidemic, most patients with Chagas disease do not have access to healthcare facilities. Both diseases are also highly stigmatizing, a feature that for Chagas disease further complicates access to essential medicines, as well as access to serodiagnosis and medical.
Chagas disease is an illness spread by insects. It is common in South and Central America. Infected blood-sucking bugs, sometimes called kissing bugs, spread it. When an infected bug bites you, usually on your face, it leaves behind infected waste. You can get the infection if you rub it on your eyes or nose, the bite wound or a cut. The disease can also spread through contaminated food, a blood transfusion, a donated organ or from mother to baby during pregnancy. Chagas disease symptoms. Chagas disease has 2 phases, acute and chronic. The acute phase may have no symptoms or very mild symptoms. Symptoms include fever, general ill feeling, malaise, swelling of one eye, swollen red area at site of insect bite. After the acute phase, the disease goes into remission. No other symptoms may appear for many years. When symptoms finally develop, they may include constipation, digestive problems, pain in the abdomen, swallowing difficulties. Chagas disease treatment. The acute phase and reactivated Chagas disease should be treated. Infants born with the infection should also be treated. Treating the chronic phase is recommended for both children and adults. Adult patients should talk to their doctor about whether to treat chronic Chagas disease. 2 drugs are used to treat this infection, Benznidazole and nifurtimox. Both drugs often have side effects. The side effects may be worse in older people. Chagas disease is a common disease, yet every individual needs unique treatment and care. We encourage people with Chagas disease and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about Chagas disease and how to treat Chagas disease, just click on the link at description or visit www.mainmd.com. Thank you.
Look at that. And then look at that. Huge difference. It's double the size.
Dr. Shiba Maimendi works as the director of Chagas disease research at the UCLA Medical Center in Sylmar. She is explaining how the parasite from the kissing bug causes heart failure.
It doesn't matter what your ethnicity is. If you get the parasite, it invades the organs and it kills the organs over time. When it bites,
The kissing bug exists here in Los Angeles, living in cracked roofs in nature areas like Griffith Park. While more than 300,000 people in the United States have Chagas disease, research groups like the one here at the UCLA Medical Center are struggling to get the funding they need. Medical experts claim this is due to a lack of awareness of neglected tropical diseases here in the United States, making it difficult to find a cure. Dr. Peter Hotez gives presentations around the country about neglected tropical diseases to help increase awareness.
And that's what we're trying to address, the plight of this bottom billion, these people with no money.
Dr. Maimendi believes there's one way that will definitely help gain public attention.
I always say that if there's a prominent individual out there, politician, movie star, where someone in their family gets Chagas, then suddenly the attention will be brought to it, because this is a condition that we can do something about.
I'm Juliana Ruiz, reporting from Los Angeles.